Hello, my name is Deirdre McKenna and I'm a social worker in the Southern Health and Social Care Trust. And I've been involved over the past couple of years in offering what we have called the Heart of Living and Dying conversations. You may have seen them advertised on social media or in the local press. And the Heart of Living and Dying conversations are an opportunity for people, members of the public like yourselves, to come together in small groups, small support groups, to have a conversation about what really matters to us in our living, and when the time comes, what would be important to us in our dying. But we're in a very different reality now. With COVID-19 pandemic turning a lot of us into physical distancing, staying safe at home in our own homes, it isn't possible for us to come together in the groups in order to have the Heart of Living and Dying conversations. And the other thing about this context that we're in, the pandemic, is that probably for most of us it's the first time that we have been forced to face the reality of our own mortality. And for some of us that can be quite frightening. So I want to offer you the bare bones of the Heart of Living and Dying conversation, so that you're able to have this conversation with people you care about or who are significant to you, and to give you a chance to think about what really matters to me in my life, and when the time comes for me, if I were really, really ill, what would be important to me then. So I'm going to break down the Heart of Living and Dying to our conversation into the, as I say, the bare bones, and break it down into 3 parts, and invite you to consider for yourself, to take a wee bit of time to pause and to reflect on some of those things that are really important to you. And for example, some people would say that it's family, it's faith, it's friendships. So just give yourself an opportunity to think about what it is for you, what is really important to you. The second part is then, having thought about it for yourself, who can you talk to about what matters to you in your living and dying? Who is significant to you? For some of us it is our family members, for others of us it could be a good friend, for some of us a significant neighbour, a good relationship there, and for others of us it might just be our GP. And then the third piece, to encourage you, maybe just to make a note of the fruit of your reflections. So I'm going to offer you some prompt questions that might help stimulate your thinking. And remember, these are heart conversations that we're talking about. So a prompt question maybe to start you off might be, some of the things that are really important to me in life are. When I look back on my life, some of my happiest memories are. In difficult times in my life, what has sustained me is. What gives me courage in difficult times is. And when I think forward to a time when I am very unwell, what would be my hopes, my preferences, or goals of care. What would be important to me at that time? And in this context of the COVID-19, while it is really important to think about preferences and hopes, we recognise that it may not always be possible that they are all actualised. So when you've taken some time to think about those things, and using those prompt questions if they're helpful to you, maybe begin to have the conversation with someone. And it is a special kind of conversation, but these are extraordinary times. So it's a heart-to-heart conversation. And don't worry, there could be tears. There may be a very emotional experience for you. But studies show that having these conversations increases a person's peace of mind, gives them great peace of mind that they've spoken from their heart in relation to these matters. And also for relatives or family members, having these conversations, according to the research, can ease their concerns about making decisions on your behalf. So those are very compelling reasons to have these kind of conversations. And once you've had the conversation, maybe you'd like to make a note, a record of it, and make sure that your GP or any of your healthcare professionals know your wishes. And I suppose the other thing that I'd really like to say to you is I worked in hospice for a number of years, and there are a few really important words that we need to say to each other and that are appropriate at any time, maybe more especially in these extraordinary times. And the words are these: I love you, I'm sorry, I forgive you, and thank you. So I would encourage you to think about who it is you would like to say those words to, or who it is you need to say those words to. And so finally, the last thing that I want to say to you, almost the last thing, is that once you have this conversation, once you've had the time to think about what matters to you in your living and dying, it's done. Then you get on with living your life. You get on with the business of staying safe, staying well, staying indoors, and washing your hands. But if you wanted a wee bit of further guidance, this booklet, Your Life, Your Choices, is available in almost all pharmacies. And it might be possible that we will recommend to pharmacists to maybe put a stash of these booklets outside of their pharmacy so that you don't have to actually go in, now that we are trying to safeguard one another. But that's a very useful book as a guide to you. As time goes on, I would hope that we'll make another video, maybe to help you with these type of conversations, or to offer you other tools that you might be able to use for your sake and for the sake of your family and friends. And particularly in these times of either social isolation or physical distancing, these tools might be really useful to you, because we probably have never taken the time before to begin to think about this. So as I say, have the conversation and then concentrate on living. Thank you.